My daughter Jasmine died in 2011 following some failures in her care. I was not an equal partner in her care. And what I mean by that is she was let down by communication failures between healthcare staff and me, and between staff themselves. I was expressing great concern over deterioration. A tertiary hospital was asked about how the local hospital should manage her. They weren't told that she was deteriorating, and then therefore the tertiary centre gave different advice than the advice they would have been given if they had have known about that.
The biggest barrier to safety is always communication. The ability for people to talk to each other, be open, have that open culture that allows people to honestly approach each other and say, hey look, I can see something possibly going wrong here. And if that's not listened to, we see bad safety incidents happening all the time. So for me it's incredibly important, both as a long-term conditions patient but also as a member of staff, that we have patients allowing us into that story, allowing us to see that emotion that happens, and for us to then reflect and respond to those things that they raise. If we're not understanding what actual patients are going through, then how on earth are we going to learn?
I've suffered with a chronic leg ulcer for about 15 years, so I was invited to come here today to speak about what it's like to live with a leg ulcer from a patient's perspective.
Some of the biggest initiatives that have come through healthcare, like the Hello My Name Is campaign, came from doctors from their experience of being patients. So there is something about being a patient and the awareness of what it feels like to be a patient that really influences how people think as doctors and often makes them better doctors.
Medicine, like all other areas of human endeavour, involve making decisions. And sometimes it's decisions that we make with incomplete information, sometimes with conflicting information. If we make that wrong decision, we get into trouble. What we've got to do is to create an atmosphere where people can go in and say, look, I didn't mean to do any harm. I put up my hands, I did wrong, so the patients and their families can get a proper answer as to why things did go wrong, and to give workers an opportunity to also put things right.
I think the biggest barrier to learning and improvement in safety is the fact that most people are afraid. As soon as something goes wrong, they're just afraid to acknowledge it, and that fear just escalates and it leads to very perverse behaviours. Silences, scapegoating, bullying, everything that is literally the opposite of what you need in order to learn and improve.
Everybody has a role to play. We've got to be honest, where we are at the moment isn't where we need to be. If we can all work together towards fostering a just culture where there's system accountability, but we are not looking at individuals to blame for the complex system when things go wrong.
My ideal for patient safety in relation to autism would be that greater understanding and a recognition of what people with autism diagnoses can offer, rather than seeing them as a problem which drains resources out of systems. Let's think about how we can maximise their different skills, their different perceptions, for example their incredible focus.
My ideal for patient safety really would be that there would be a one system for all. Not necessarily that there wouldn't be the private hospitals, but they would all be regulated the same so that policy and procedure would go across the board.
My ideal vision for patient safety in the NHS is to improve communication. When medics, patients and families communicate in a good way, patient safety can only be enhanced.